Hey everybody, this is Dr. Paul Thomas with Plum Health DPC here in Detroit, Michigan, and today I'm giving a coronavirus update for August 2020. Here's where we stand in Michigan. To date, there have been 6,325 deaths due to the coronavirus. And as of yesterday, there were 465 confirmed cases and one additional death. As it stands right now, the majority of the cases have been concentrated in Southeast Michigan, affecting Wayne County, Oakland County, and Macomb County. I did want to point out, however, that we had a very large spike of the virus in March and April, and we've been trending down over time. This is the data for Wayne County specifically, or for Detroit specifically. And in Detroit, we did have this large spike at the beginning of March, or end of March, beginning of April, and we've gradually trended down. We did have a little bit of a blip or an increase in new cases after the 4th of July. So if you look towards the right on this slide, you'll see that there wasn't a significant increase over that 4th of July weekend. And we can attribute those things to people gathering together, spending time with family members, maybe a few too many barbecues and meetups around those holidays. So we really have to be mindful about that going forward. Comparing that to Oakland County, Wayne County's done a much better job, or Detroit has done a much better job in terms of sustaining the flattening of the curve, where I think perhaps in Oakland County, people are a little bit more relaxed about restrictions, and you're seeing higher rates of recurrence in Oakland County at this time. The same can be said for Macomb County. There's been a big spike, almost to the levels of early April, late March, where you're seeing large spikes in new cases emerging in Macomb County. And some people might be attributing those new cases to large gatherings that are happening in Macomb County. We saw that there was a big party around Jobby Nooner. There was a large party around a float down. There was a gathering of boats in Macomb County. So these sort of interactions where people may be disregarding the social distancing rules can have a tangible effect in the way this virus spreads throughout the community. And it's not without consequence. There are still people dying from coronavirus. And you might want to compare it to people dying in car accidents or people dying from heart diseases. But, in my opinion, as a physician, as somebody looking at the health of the public and on a community level, one death is too many. And anything that we can do to prevent the death of our, fellow man, citizen, neighbors, friends, colleagues, this is something that we should act upon, because our individual decisions can put people at danger if we're not wearing a mask or if we're not maintaining proper social distancing. So this is why it's important. So we're going to go back to the Detroit data just to show that in Detroit, you have your cases and then you have your deaths from COVID-19, and you can see a nice tapering, but there are still people who are dying from COVID-19. So we should really do our best effort, do our due diligence to protect ourselves and our neighbors by wearing a mask and maintaining our social distance. One thing I wanted to point out is that 1/4 of all the COVID cases in the world are happening in the United States. So there's been about 21 million cases globally of COVID-19, and unfortunately 5 million of those cases, 5.354 million of those cases have been in the United States. And this is the real tragedy of how we've responded to the coronavirus. We could have had a robust response from our government and from all of the stakeholders in our country. We could have united around fighting the coronavirus, but instead it's descended into a political issue, a partisan issue, and it's really harmed our public health. And I think we're going to look back at this time as a dark time when we might have said what could have been if we all rallied around this idea of social distancing, wearing masks, and protecting other people in our community. But instead we have the highest rate of coronavirus in the world. All right, so another thing that my patients and that people in the community are asking about is the Henry Ford immunization trial. A few of my patients have signed up to get the immunization. They have a placebo group, meaning patients are basically injected with maybe salt water or saline and then you have the actual treatment group, the people who are getting the immunization. And this is a phase 3 clinical trial, meaning that it's safe in humans, and they're just trying to figure out, is it better than what exists out there? Is it better than using certain drugs, or is it better than placebo? And so we're going to see what happens. And unfortunately, I don't have all the answers. My patients who've asked me, is it a good idea to participate in the trial? Is it a bad idea? I think it's a reasonable idea. I think you're stepping up as somebody who's willing to take a risk and get the vaccine, and it could be helpful for you going forward. It could confer protection from the coronavirus. It could prevent further morbidity or death, morbidity or mortality. It's a reasonable thing to do, but I don't know what's going to happen, and that's why it's a vaccine trial. We don't have all the answers yet. Some other frequently asked questions, some things I highlight usually every time I do one of these, is what are the symptoms of COVID-19? People feel fever, cough, shortness of breath, chills, muscle pain, sometimes muscle aches or shaking. People will have like rigidity or tremors when they get COVID-19, headache, sore throat, loss of taste or smell. If you have any of these symptoms, please contact your doctor. If you're a patient of ours, or if you'd like to become one of our patients, please call our office and we'll coordinate for testing for you. There's free testing up at the City of Detroit, Woodward, and 8 Mile. And then if you're a restaurant worker, you're eligible for rapid testing via the City of Detroit. And then there's some other healthcare facilities, places like CVS, Walgreens, some urgent cares locally that are offering testing as well through your insurance if you have it. How can you protect yourself from exposure? So the number one thing to do is to wear a mask, even if you're healthy. It's really important to wear a mask when you are in a grocery store or in an enclosed space with other people. I don't have my mask on right now because I'm recording this video, but whenever I'm in my office and seeing patients, I wear my mask always. It's really important as a way to protect ourselves and protect others. You know, if 2 people are in the same room and they're both wearing masks, you drop your risk of passing the virus to something like 3%. And that's because it's providing a barrier for your respiratory droplets and preventing the spread of the virus that way. You definitely want to wash your hands in soap and water. Avoid touching your face with unwashed hands. Cover your mouth or nose when you are coughing or sneezing. One way to do that is just to pull your arm in front of your face and sneeze into the crook of your elbow. It's a great way to prevent the spread of virus. Stay at home if you feel sick or if you contact somebody who has been sick. And this is a really difficult thing because you may have got your hair cut by somebody who later tested positive for the virus. So technically, because you came into contact with that person, you should get tested and then you should self-quarantine for 1 to 2 weeks. 2 weeks would be really safe. 1 week would be a reasonable thing to do. If you do go out, please keep 6 feet distance from other people. A lot of restaurants and businesses in our community, in Detroit especially, have been doing a great job of spacing out tables, spacing out customers, making sure they have the little placards on the floor at the checkout line of the grocery store so that people are maintaining that 6 feet of distance. So I just want to say thank you so much for watching. Have a wonderful day and stay safe out there, everybody. Take care.